The single biggest spike in one day. 32 more coronavirus cases in England in just 24 hours. From Lancashire to London and Carlisle to Manchester. 29 of these had travelled abroad, but nobody knows how the other 3 caught the virus. This is a health crisis that threatens to grow into an economic one. Workers forced to self-isolate, but fearful of losing income. Some reassurance from the Prime Minister.
I can today announce that the Health Secretary will bring forward, as part of our emergency coronavirus legislation, measures to allow the payment of statutory sick pay from the very first day you were sick instead of 4 days under the current rules.
Will he guarantee that workers' right to sick pay from day one, as he's just indicated will apply on statutory sick pay, will apply to all claimants and those people that are not currently eligible for statutory sick pay?
We are very much aware of the issues faced by the self-employed on those on 0 hours contracts. I should stress that some of them will be entitled to statutory sick pay. Others, a great many.
Emergency legislation will help to reinforce the government's containment strategy. It doesn't want infected workers to spread the virus, but it doesn't really address the concerns of, say, freelancers or self-employed people who work from home. They're the sort of people that, if this virus really does take hold, could be hit really hard.
So I remember getting the lesson when I was Health Secretary.
In Scotland, First Minister Nicola Sturgeon thanked NHS staff for their response to the outbreak. 2 new cases here, bringing the total to 3. And the same in Northern Ireland, 2 more cases recorded here. This new public health campaign rolled out to make sure people are getting the message. The rise in cases confirming the government's fears.
With all epidemics, what happens is they start off very slowly and then they gradually gather momentum and then suddenly go up relatively fast. Now, we usually have a reasonable period of warning before that happens, and we are modelling this out quite carefully. From the time that we get established transmission in the UK, if we get established transmission in the UK, which I think at this time is more likely than not, then there will be a number of weeks, probably about 6 weeks, before we start to see a significant amount of transmission.
This increase has prompted a warning from doctors who fear they'll be left exposed as this crisis develops.
They have worries about their own protection. In particular, in general practice, they need to receive supplies of appropriate masks, and that is the same, of course, for our junior doctors and our consultant SAS colleagues in emergency medicine departments and anywhere on the front line.
The response to this outbreak may well be entering its next phase. As the numbers leap, containment may no longer be viable. We're not in the delay phase yet, but we are very close. Ashish Joshi, Sky News.